In this video, we'll see what is scorpion sting and what are its signs and symptoms and its management. So scorpion is the venomous animal. After snake, common species in India is Mesibudus tamilis. It is also called red scorpion. So we'll see some features of scorpion. So they has cephalothorax. So as the name implies, cephalo means head and thorax means chest, which means they have fused head and chest. And it has abdomen and six-segmented tail, which terminates in bulbous enlargement called telson. And then it has 8 legs, and this telson will contain stinger and venom apparatus. In addition to this, it has 2 claws, which help to grasp its prey. And then we'll see color of scorpion. It may vary, it may be yellow, or light brown, or black. So there is a fact that scorpion with thick and powerful claws are less toxic, while those with slender claws are more toxic. So we'll see what all the clinical manifestation caused by the scorpion sting. So it includes local effect and systemic effect. First we'll see the local effects. So there will be excruciating local pain, which will be like severe burning pain. And then swelling will be there, and redness, and finally regional lymphadenopathy. We'll see the systemic effect first. Mydriasis. So mydriasis means dilated pupils, and then profuse sweating, urticaria, excessive salivation, vomiting, parasternal lift, priapism. So priapism means continuous and painful erection of penis. And then hypertension, brady and tachyarrhythmia. So all these effects are mainly due to the stimulation of autonomic nervous system. So other systemic effects includes pulmonary edema, which occur within 2 to 3 hours of sting, and then intracerebral hemorrhage, which leads to hemiparesis from scorpion sting, and convulsion may occur. And then hyperglycemia, it will be common with all species. And then allergic reaction also will occur. And then nausea and vomiting, and mild hypotension will also be present. So we'll see the abnormalities of ECG in scorpion sting. So there will be peak T waves in lead V2 to V6, and then Q wave, ST segment elevation in leads 1 and AVL, and left anterior hemiblock will be seen. So we'll see treatment of scorpion sting. First we'll see whoever needs treatment, and whoever does not need any treatment. So most victims without hypertension and cardiac disease and children over age of 5 can be handled at home with local application of ice and oral analgesics. And then patients with hypertension and cardiac problem and elderly and children under 5 years should be referred to hospital for evaluation. And then what are the things to be followed during transportation to hospital? First we should ask them to immobilize the affected extremity, and then should not apply tourniquet. Prolonged cryotherapy, which is nothing but prolonged or continuous application of ice, is contraindicated. And then do not incise prior to suction. So we'll see what are all the treatments given in hospital for scorpion sting. Patient with renal failure and CNS disturbance should be mechanically ventilated. And then we'll see the symptomatic management for scorpion sting. First, to control pain, we can give paracetamol as analgesic. And then to control allergic reaction we may give antihistamines, corticosteroids, and adrenaline. And for severe anaphylaxis, we need to give O2 supplementation, and then adrenaline. While doing this we need to monitor ECG, and then IV fluids are given. So we need to be cautious while infusing fluids, because as large amount of fluid infusion may leads to pulmonary edema. And then to control hypertension sublingual nifedipine is given. Hyperglycemia is controlled by prazosin, as it stimulates secretion of insulin. It lowers blood glucose level. Pulmonary edema is treated with prazosin or furosemide given in IV along with O2. Life-threatening pulmonary edema is treated with nitroprusside drip. For convulsion and agitation, diazepam is given in IV. Alternative to diazepam is phenobarbital. Finally, for cardiac rhythm disturbance like persistent tachyarrhythmias, can be reversed by giving metoprolol, or esmolol, or propranolol, given in IV slowly. So it is repeated every 5 minutes, until desired response seen. So patient with more severe symptom require airway support, and 1 to 2 vials of IV antivenin. So antivenom therapy is beneficial in young, elderly, and those with hypertension. But most people develop serum sickness syndrome within 2 weeks of antivenom administration. So to prevent scorpion sting, we need to clear debris or rubbish from areas of work. Then by use of repellents, we can prevent scorpion sting. Inspect shoes, clothing, bedding before use. So there is a fact that if one scorpion has encountered in an area, there will be others around. If you like this video, please do subscribe, like, and share. Thank you.